Hello, this is Dr. Stanley Lang, and welcome to this broadcast. I'm going to go off my usual topic of whole person health to address an issue that is at least related because of the impact that environmental toxins has on our health. But it does cross over into, this topic will cross over into controversial areas that require some degree of political correctness if you're going to be on the inside, so to speak. And the issue that I'd like to talk about today is the concept of informed consent as it relates to vaccinations, and particularly Thimerosal, which is a preservative that's used in still some vaccinations. Now, the reason I decided to create this brief video is to encourage parents to take their responsibility seriously for making sure that the treatments that their children receive are the very best. And the problem is that parents rely on the medical advice that's given to them, and doctors, by and large, attempt to give the best advice they can based on what they've been taught. Unfortunately, sometimes falsehoods drip into the medical literature, and therefore there is a risk that false ideas get propagated and transmitted to parents in regards to some of the treatments that might be recommended for their children. In particular, I'm talking about vaccinations. Now, I'm going to read from a couple of different articles as part of what I'm going to be mentioning in a few moments, which is that you need to have as accurate information as possible all the time when you're making healthcare decisions. And sometimes we don't have all the information. We only have some information. We have to try to connect the dots in the best way possible. But recently there was an article on one of the news services that was highlighting an outbreak of mumps in Arkansas and in Texas, and there were people sort of decrying the lack of vaccination in some of these areas and kind of wondering, why is this happening? Why are parents rebelling against the medical recommendations in increasingly higher numbers? So I'm going to read from part of that news article, and so they're describing what's going on in this particular situation where a smaller number of parents are agreeing to vaccination, which in Texas they have to agree. It's not something that's required of them to agree. They have to agree to the vaccination recommendation. So there's a particular state rep that wants to create a law that would require mandatory re-education for these parents. And so this particular representative, I won't give the name, says, quote, "For some reason, there's a growing movement afoot to question the science and effectiveness of vaccines," unquote. Now, I'd like to go from that observation, which is definitely true. There is a growing movement to question the truthfulness of some of the things that are being stated, and it's partly because in 2014 there was a Dr. Thompson who came forward as a CDC and basically confessed that he participated in falsifying some of the major research that was published about the safety of the MMR vaccine. And he basically said in his testimony before Congress that he and the group of co-researchers had falsified the data that actually proved a connection between the MMR vaccine and autism. And there was no question that the data pointed in that direction, and they basically took the data, they shredded it, and then they published the article that basically said that the MMR is not connected to any increased risk of autism. So I'm just going to read a little bit from that article that was this recent article in a blog called EcoWatch. So, quote, in August 2014, Dr. Thompson revealed that the data underlying CDC's principal vaccine safety studies demonstrated a causal link between vaccines and autism or autism symptoms, despite CDC's claims to the contrary. According to Dr. Thompson, based upon interpretation of the data, quote, there is biological plausibility right now to say that Thimerosal, which is the mercury-containing preservative, causes autism-like features, unquote. Dr. Thompson invoked federal whistleblower protection in August 2014. Now, one of the things that you're going to see in information about children's vaccinations is the idea that the common recommendations for that these vaccinations no longer contain thimerosal in, quote, significant amounts. They have tiny amounts of thimerosal. However, there's one big exception, and that's the flu vaccine. So the flu vaccine, when it is given from a multi-dose vial, has a significant amount of thimerosal in it. And guess what? Most children get their flu vaccines from a multi-dose vial. They don't get individual dose vials in most cases. And whether you're going to your doctor's office or to a hospital or you're going to the pharmacy, most of the time those are coming out of multi-dose vials, which means multiple doses were given to multiple people, so they have to put a preservative in there to prevent bacterial growth. And thimerosal is the preservative that's being used in these flu vaccinations. Now, what vaccination is recommended for everybody over 6 months of age for the rest of your life? The flu vax. Now, one of the things that I'm trying to point out here is that true informed consent would, number one, tell you, the parent, about this report that Dr. Thompson gave in 2014. Number two, that there is thimerosal in the flu vax unless it's coming from a single dose vial. And my encouragement to you is to do your homework. Make sure that when your child is getting the flu vaccination, assuming that you're permitting it and wanting your child to have the flu vaccination, that it's coming from a source that doesn't have thimerosal in it in significant amounts. And that means that it has to be coming from a unit dose vial, not from a multi-dose vial. So the point is that one of the reasons that parents don't buy the whole recommendation being given regarding vaccinations is because of information like from Dr. Thompson. He definitely said that he and his co-scientists conspired to destroy evidence that proved a connection between autism and the MMR vaccine. So when we know stuff like that, it does make us just a little bit suspicious that what else has been falsified. That's just natural. So the point that I'm making is that there is a connection between thimerosal and MMR. It's been proven, but it's not documented because the document proof got shredded. Dr. Thompson does have the backup data, so the data is there, but he's legally prevented from sharing in other sworn testimony. So my encouragement to you is always choose informed consent for health-related interventions for your family and for yourself. Don't just assume that that a cursory understanding is sufficient. Dig deep enough that you truly understand the positives and the negatives. And I am not anti-vaccination, and I'm not trying to say that you should be anti-vaccination. What I'm saying is that you need to have informed consent about the vaccinations that you are getting, such as the flu vaccination. Is it coming from a multi-dose vial? Does it have thimerosal in it, etc.? And you should consider these things when you are making a decision on the for your family. So I hope you have found this overview of the concept of informed consent, meaning you understand all of the positives and all the significant negatives before you decide to do something. And then you weigh those So that's what informed consent is about. And if you haven't been given all the positives and all the negatives, then you haven't had informed consent in process of in your decision making. So I wish you well, God bless, and have a good day.